Next presenting company is InnerScope Hearing Technologies. It is now my pleasure to turn the floor over to the host, CEO Matthew Moore. Sir, the floor is yours.
Thank you very much, and thank you for having me today. So InnerScope Hearing Technologies is on the OTC markets, traded under the symbol INND. A few months ago, we had well over 46,000 shareholders, and we have more than that as of today. InnerScope is a data-centric, direct-to-consumer hearing device company who's focused on collecting and direct monetization of the 60 million people in North America and the 600 million people worldwide suffering from hearing loss while providing an affordable and accessible solution to all. A little bit about myself. My whole family is in the industry. I'm third generation in it. My grandfather's been doing this since the 1940s. Unfortunately, he passed away last October. But up until the day he passed away, he was still seeing and helping the hearing impaired. Not because he had to, but because he wanted to. It was in his DNA, and it's in my parents' DNA, and it's in my DNA to help the hearing impaired. I say this little adage, which is true, is that old saying that kids are meant to be heard and not seen, or meant to be seeing but not heard. In my family, you could be seeing and you can talk if you talk about hearing aids. And that's what I've been doing since I was 5 years old. And so that's again why my life is in this and helping the hearing impaired. So let's get started with the presentation. Obviously, part of this presentation does include forward-looking statements. There's also additional disclosures and disclaimers right here as well. Not a lot of people really know or understand that untreated hearing loss is really connected to so many other health conditions: cardiovascular disease, diabetes, Alzheimer's, dementia. In fact, you're actually 5 times more likely to get dementia or Alzheimer's if you have untreated hearing loss compared to the people that have hearing treatment but that are hearing impaired but are being treated by amplification, aka hearing aid. Essentially, you add all these health conditions together. A person with untreated hearing loss lives 3 years less than the person compared to someone with hearing loss but is getting amplification. So that's one of the biggest things, is that we really need to grow the awareness of these health consequences that come along with untreated hearing loss. It's an ever-growing market problem. Right now there are 60 million people in North America suffering from hearing impairment that is treatable. In the U.S. and Canada combined, there's less than 8 million people being treated, so that leaves 52 million people who need to get hearing services and hearing products, but currently do not have any. So it's a huge opportunity. It's a fragmented $10 billion industry currently. There is no big data collection on individuals with hearing loss. There is currently no available access to free hearing screening and testing. Currently, the only way to do that is to go into a local professional office like an audiologist or ENT. There's the lack of awareness of overall health and cognitive consequences living with untreated hearing loss. That's that dementia, Alzheimer's, as well as many other health conditions. The high cost of hearing aids. Right now, it's a 98% of the industry. People buying hearing devices are buying it in the brick and mortar setting. Less than 2% is direct to consumer. What that does, that creates a high cost. It's a $4,000 to $12,000 a set for hearing devices. And this is not including additional follow-up fees from the professionals. And then finally, the low accessibility to hearing products and services. Right now, the majority of 98% of that, 98% of the people buying hearing devices annually are still buying them only in the in-office model, not as a direct-to-consumer product. The market opportunity is huge. Right now there is in North America there is it's a $6 billion industry in North America, $10 billion worldwide. But that only represents about 2.2 million people a year buying hearing aids, and that's what equals the 6 billion. So you think about it, with the growth and the opportunity of selling, millions of new people, people that need products, selling them, buying our products or someone else's products. Rising tides lifts all boats. The idea is there's going to be millions of people. Right now there's less than 10 direct-to-consumer hearing aid companies, and we're all going after this 52 million people. So, there's not much competition when it comes to direct-to-consumer hearing aids. Now, hearing loss and hearing product awareness is actually reaching an all-time high right now. In fact, actually, the President Biden actually talked about it. Actually, did an executive order just recently, back in July, basically pushing for the FDA to finalize and release the over-the-counter hearing aid law. Basically, it's allowing someone to buy hearing devices over the counter and label it as such. InnerScope, we have FDA-registered direct-to-consumer hearing aids, which are 100% allowed, and that is what we're selling as of today. So it just adds additional clarification, additional marketing opportunities, additional partnerships with retailers down the road once the OTC regulations have been finalized and released. But again, we are 100% able to sell direct-to-consumer hearing aids, and it's been doing that for decades in the industry. We've been doing it for years. So that is where the opportunity lies, is the increased exposure of hearing aids and hearing health. I had a video, but unfortunately the video is too large to play, so I can't play the video as of today. You can view it on our website at a later time. The InnerScope, we provide the market solution. We are here to inform and empower consumers to take control of their hearing health. We provide a direct-to-consumer delivery system, basically hearing care for the 21st century. Hearing care basically moves out of the clinics into online and in-store and into people's homes. We've developed and are deploying automated self-hearing screening kiosks as an online hearing screening program with big box retailers, pharmacies, grocery stores, to educate the consumers as well as to gather data, opt in, get data on those individuals for further consultations as well as remarketing opportunities. We're providing the public awareness of the consequences of cognitive and multiple health issues from living with untreated hearing loss. We're also providing highly accessible, affordable in-store and online direct-to-consumer hearing aids and hearing services at a 50 to 75% reduced cost without sacrificing quality and without the need for visiting an in-clinic hearing professional. So basically, a person can buy a FDA-registered direct-to-consumer hearing aid today from our website, from our partner, from our distribution company's websites as well, and basically never have to leave their home to hear better again. Now, to go into our hearing screening kiosk, we built these hearing screening kiosks. It's a fully self-test automated system. Within 3 to 4 minutes, a person puts the headphones on. With 3 to 4 minutes, it provides the results of that. It basically tells them if they have some hearing impairment, and they could be helped by a InnerScope product, or we can refer them to a local professional as well. The idea is to grow the awareness and to create that call to action to take care of your hearing health and to address your hearing loss. These are highly engaged self-tests and kiosks. Right now there is no big box retailer or national pharmacy that is offering these hearing screening kiosks similar to InnerScope. So we're kind of first on the market when it comes to this distribution of these kiosks. It's like a blood pressure monitoring station. So, our objective is to launch this in thousands of locations around the country, in North America, even globally. Right now we already have multiple interested retailers that total over 10,000 locations. We're actually going to be starting pilot programs with these retailers in a matter of weeks, to launch the pilot program for automatic growth built into it. So it's not a proof of concept. It's going directly to pilot program to ramping up within a matter of a few months after the pilot program launches. The hearing screening kiosk actually has three revenue models. One is the B2B wholesale distribution. This is where we launch it in a retailer. The retailer offers our products on the shelf or on their website, and we have that B2B connection. So when a person takes the test, it directs them to purchase a InnerScope product directly from that retailer through in store or on their website. So that has that B2B relationship. We have an online referral model, which basically is that if the retailer does not carry our products at this time, the kiosk would direct them to our direct website, so that way they can further purchase the product and see the additional products that would assist them. And then finally, we have a referral model to local brick and mortar hearing centers. That's basically where we are. The kiosk goes through the process and says, one of InnerScope products would benefit from you, but if you would like further consultation, we can refer you to a local professional as well, and InnerScope gets a referral fee from that. So either way, there is direct monetization from the kiosk. We also have an online hearing test platform for data collection. Same program, similar program as the one that's actually in the kiosk. We're going to be launching these hearing screening programs on retailers' websites. Again, further building that distribution channel for our products. And so that way, someone from their home can actually go on this retailer's website, test their hearing, find out if they have a hearing loss or not, and then buy one of InnerScope's products directly from that retailer without leaving that retailer's website. That creates that B2B wholesale relationship. But the key element is that the loyalty of that customer with that retailer is high. So that's where we would be, generating massive interest in revenue streams from that. The game-changing solution is that we've with technology partners around the world, we've developed and deployed a app-controlled, rechargeable direct-to-consumer hearing aid. This hearing device is fully rechargeable using a person's iPhone or Android app. Can actually get the devices, can actually perform a simple hearing test or hearing screening on their device, and actually provide self-adjustments to the device itself, as well as there is that direct connection with our local licensed professional here in my corporate office here in Roseville, California, just outside of Sacramento. So that way, if the customer needs that additional assistance, we're here to provide that professional adjustments to the customer. We have a full product portfolio. This is just scratching the surface. I mean, we have additional hearing devices, direct-to-consumer hearing aids, go over the ears, ones that go in the ear, ones that go to our neck loops, as well as we offer hearing and tinnitus vitamins that we've worked with a PharmD, and we formulated this over the past couple of decades. We have very good success with these vitamins for hearing loss and for tinnitus. Again, just complementary to our products, as well as a full line of hearing and ear care accessories and cleaning supplies, like cleaning your hearing devices to even cleaning out earwax. So again, it's creating that brand loyalty around InnerScope and our products. Our website, myheariq.com, is our e-commerce platform. We have just recently launched that to offer our products. It's a highly designed with proprietary algorithms on SEO to generate that organic growth versus paid ads. We are, of course, working on doing the paid ads, Google ads, Facebook, Instagram, you name it. But the SEO, creating that organic strategy, is what's really going to continue to push us forward. We've recently launched a subscription-based hearing solution. This is where a person can come on, pay a minimal down payment to kind of start the subscription program, as low as $250, and then which includes the first month. Then it's $44, around $43 to $44 a month for the next 24 months. And then between month 18 or so to 24, they can actually upgrade for a new set of devices. without adding that extra down payment. So it's just a continual, every 18 months to 2 years, they're getting new hearing devices. And plus, they get to keep those older hearing devices as well and give them to a friend or family member to also continue to grow the awareness and really help people, even if financially it gets even more, if a person still can't even afford the $44 a month, then the hand-me-down status, which then would provide a professional assistance on refitting those products, would be very beneficial. We have we have a national advertising and marketing 6-month campaign. We're launching hearing, TV commercials on major financial and news stations like Fox News, Bloomberg News, MSNBC, CNBC, CNN. You name it. We're launching these commercials, the 30-second commercials. I had a commercial on here, but unfortunately the file was too large on this to play it. But which again you'll be able to see it on our website. But again, these 30-second commercials are there to again grow the awareness about the company, about our products, about our subscription and our services, and basically again really start to create that sales funnel to generate the awareness, the interest, and again the person finally coming to the bottom of the sales funnel, which is purchasing a product. We have multiple distribution points already. We are already in various stages of deployment and development with national and regional big box retailers, pharmacy chains and franchisees, and grocery stores. We're currently have our distribution with Walmart, Amazon. Just launched LT e-commerce, which is FSAstore.com, HSAstore.com, and WellDeservedHealth.com. Right now, we're the only hearing aid product that is currently available on those platforms, and that's through our Cardinal Health at Home distribution connection. InnerScope is in committed pilot programs with various retailers for our hearing health products and hearing screening kiosks. We have multiple distribution agreements already executed, with fully executed distribution agreements expected with dozens of retailers in the next 6 to 12 months. Basically, we are expecting to be represented in hundreds of businesses and thousands of locations around the country over the next couple of years. Our team, myself, co-founder, CEO of InnerScope, you see my Mark Moore, I call him my older brother, also my father, let's say. My parents and I, we live and breathe this industry. So we are all about helping the hearing impaired, and we've owned and operated well over 75 audiological clinics. We know what it takes to help the hearing impaired, and that's where we're increasing our reach to hundreds of thousands, if not millions of people around the world. We've recently added our medical director, and he is a board-certified ENT, ear, nose, and throat doctor, physician. He's working with us to validate our products, working with us on our SOPs, on our basically everything that we need to do to ensure that we're helping the hearing impaired on a mass level. So so he's fully bought in, and we're working with him on that. Our chief brand advisor, Chris Ivory, he's the chief marketing officer for our international clothing line, Sergio Tanchini. Chris and I are working together to create some new commercials, new advertisements, new public service announcements to really grow the awareness of hearing health and our products. He's also married to Ellen Pompeo, which is the star of ABC's medical drama Grey's Anatomy. So we have that ability to grow this within the creating that influencer, creating that movement to help the hearing impaired and get the awareness out there that people need to take this seriously. As well as we have investor relations consultants like Skyline, Investor Brand Network, as well as financial consultant Finance North. We this is our revenue projections. This is on a more of a conservative basis on this. Every time we launch a new kiosk in a new location, that's building that compounding growth factor that goes along with it. So our first year, starts lower, and then kind of around 8 million with a 2.4 million, profit. We have good margins on our products, good margins with our processes, excellent margins, let's say. So, and then we are expecting more of a hockey stick type growth strategy while we are launching these kiosks in thousands of locations over the next 2 to 5 years. Of course, we are looking at uplifting to the NASDAQ as soon as possible. Who isn't? I mean, that's what our strategy is. That's been our goalpost from day one. So with that being said, it's all about the timing and efforts that go along with that. So we are expecting to go down that road within the next 6 to 18 months, if not sooner, as soon as the timing is right and once we start really rolling out all these kiosks. Now, finally, our roadmap, we have immediate objectives where within the first, next 90 days, we've launched our latest direct-to-consumer hearing aids on our current distribution channels like Walmart, Amazon, now FSAstore.com, HSAstore.com. Again, that's through the Cardinal Health at-home network. The launching products with various undisclosed online and brick-and-mortar retailers. So unfortunately, due to NDAs, we can't fully disclose our distribution path with our kiosk and our products as of yet. We're, very, very, very close to making those announcements happen with these. So we have numerous retail partners launching our kiosks as well as our products. Through this, we're working on the phase 1 of our marketing and branding awareness campaign that we're working with, and then working with the Chief Brand Advisor, Chris Ivory, to kind of, again, make that, that buzz around hearing health and hearing health awareness. Launched our hearing care subscription solution. And then finally, also within the next 3 to 6 months, deploying the 100 plus hearing screen kiosks, again, with various retailers. Launching our fully streaming direct-to-consumer hearing aids. This is where our products will actually be streaming directly. Consumers are streaming music, cell phones, directly to your hearing aids. We're also deploying phase 2 of the marketing with Chief Brand Advisor, as well as we are going to be closing on some IP and some acquisitions of another direct-to-consumer hearing aid company that we already have signed LOI, and we're hopefully going to be closing on that very soon. That's going to add a lot of technology, a lot of distribution. It's going to add a lot to InnerScope. And then, of course, over the next couple of years, we are going to deploy 1,000+ hearing training kiosks with various retailers. And the idea is to be represented in hundreds of businesses in thousands of locations in North America and globally. So that is the presentation. Now I want to open up for Q&A on there. We only have a minute left, so I'm not going to be able to get to everyone. But if you want to email us at ir@INND.com, that's ir@INND.com. If you email us, we'll be able to answer all of your questions as much as possible. So again, we are, thank you to everyone for being with us today, and we look forward to answering your questions through email and presenting additional updates here in the near future. Thank you very much.
Ladies and gentlemen, that does conclude the InnerScope Hearing Technologies presentation. Thank you for joining us. You may now disconnect.